Good afternoon, and welcome to today's coronavirus briefing. First topic, earlier today, the White House approved the North Dakota's presidential disaster declaration. This was something that we submitted last Saturday, approved this morning. We put for those in the press corps that are here and listening in, we did put a press release out on this separately today at about 1:40 p.m. You can look to that for details. But of course, this approval paves the way for North Dakota to receive federal funding at state, local, tribal level, and also certain nonprofits that often are involved in emergency relief, such as Red Cross or Salvation Army. So that's the first item of the day. Second item of the day is our reports of cases. And today, the North Dakota Department of Health confirmed 21 additional cases of the novel coronavirus disease, or COVID-19. Our total for the state now stands at 147. And as you can see on the curve cases, again, we had a little bit of reprieve earlier, but now we've had 3 days in a row where we got that steady climb up. And this is, again, something that why we continue to make sure we're preparing for a potential peak that could be still weeks away. When we take a look at the total cases in North Dakota, we've made some updates to this chart in part based on questions from the press corps. We now include on this, and this will be published online, includes the number of folks that are recovered and the number of deaths. So for all those who are doing their math on the reporting, this should all net out. But again, you see here where this continues to climb with the 21 new cases today. We also continue to do some analysis on the county by county basis, and we did want to share the data on the tests, completed tests by county. That slide is coming up. And again, when some people might look at this and say, oh, we're doing a lot more tests in our metro areas, what about the rural areas? We've also then will be sharing tests per 1,000 people, which comes up on the next slide. And here I think you can see that that we've got some counties that might have been reported on social media that we weren't doing that many tests, when in fact we're doing not only leading among the counties in terms of tests per 1,000 people, but we also, when we compare this, the Lieutenant Governor's done a nice analysis of other states, but we've got some counties, including like McKinsey, that if they were a separate state, they'd be in the top 5 of number of tests per 1,000 people of any state in the country. North Dakota still is in the top 10 as a whole, but the point of this message here is that we are, relative to other states, doing a good job on testing, but we're not where we want to be, and we've got some strong efforts going on, working through our unified command to try to, and working with the White House and working with others, working with testing companies to try to see if we can continue to move forward, because testing is part of the answer and part of the answer to the puzzle which we have, which is making sure that if someone does test positive or someone is associated with someone who tests positive, that we want to do not just the testing, but then the contact tracing, the follow-up, to make sure that those people who either have COVID-19 or have been exposed to it, that those are the people that especially need to absolutely positively be following the 14-day isolation rules. That's the way with the least amount of effort we can save the most number of lives, is through that targeted. But until we get more testing up and going, that would allow us, a lot more testing, as we're showing numbers here in the thousands of tests across the whole state that have been completed, 4,600 for our state. We need to be perhaps in order of magnitude higher than that if you're talking about testing people before they go back to work, or in which we know this is some of the folks that are further down the curve, like China and Korea have done. So that's where we are, and that's where we're headed. But what all of this means is, whether your county has a positive case or not, we've done testing of people in all but 2 of our most rural southwestern North Dakota counties, but it all comes back to the same message, which we've been talking about, being North Dakota Smart, which is really about in a nutshell, and stay home, stay healthy, and then stay connected. Stay connected by keeping your physical distance, but stay connected with your loved ones. Stay connected with your teachers if you're a student. Stay connected with your work if you're working from home. But this is really what we've been talking about, and this is how we slow the spread. And by slowing the spread, we save lives. Next topic relates to unemployment. And we've been releasing that data each day. On Tuesday, yesterday, we had another big day, 2,574 employment claims filed through 3 p.m., and that was yesterday, 2,574 for yesterday. Today through 3 p.m., 1,406. That brings the total to 28,647 filed in the 2-week period from March 16th through April 1st today, which again, that is 7,000 more than we had in the entire year of 2019. There have been a lot of requests about waiving the mandatory 1-week waiting period for employment benefits, and we're happy to announce today that we're going to be able to make that happen. And this was always a good idea and was always under consideration. The primary factor that we had not done this sooner was an IT issue, which I'll talk about in a minute. But I do want to assure people that this is retroactive to when the period of time when these claims started coming in. And it's also be clear that waiving the waiting week does not increase the amount of money that any individual is eligible to receive. It just helps get those payments to someone sooner. So if you're eligible, if you qualify, you've got an opportunity to not have to wait a week before you get our check. And for those also that are out there that might saying, well, what does this cost to do this? There was a cost to the state in terms of us, hustling to get the IT problem fixed on an old system so we could actually pay people without the waiting piece. But this actually ends up saving us money because part of the new federal legislation, when it saves us, meaning saves the taxpayers of North Dakota money, because the federal government is willing to pay that first week of benefits for those states that waive it. This could amount to, over the course of this emergency, $10 to $20 million that we would receive from the federal government by getting this thing done. So we all had good reasons to hustle and get this done. So under the executive order that I signed just before coming down here for this briefing, all individuals with claims with a week ending the date of March 14th and going forward during this pandemic emergency will not be required to serve their waiting week. And to avoid our already overloaded team over there that's trying to handle in 2 weeks, a year, more than a year's worth of work, everybody out there who's lost their job or worried about losing a job, no action is necessary by any individual to take advantage of this. So anybody who's either filed a claim or thinking about a claim, if you filed after March 14th and you've already served a waiting week at the present time, that waiting week will be paid to them automatically. So that's nobody has to do anything. Nobody's got to call. Just file your regular unemployment and it'll be all taken care of. I do want to give a big shout out to our IT team and also, I guess, take this moment to underscore a larger point, which is it's at times like this when we realize that we've got to keep investing in our IT resources. Our IT resources are what we need to allow all of our state team members to keep delivering government from home. And in this case, this the unemployment insurance system is in the state of North Dakota is one of the last probably remaining mainframe computers in the state of North Dakota. I went and visited it shortly after getting elected because I had never seen one, or at least hadn't seen one from the 80s or 90s, and I was amazed there was one still going. It runs on a proprietary language. We're very fortunate to have a few dedicated individuals that still work for the state of North Dakota that have been supporting this and keeping this thing going. But as we head forward coming out of this, this is one of the systems we'll need to replace to give us more flexibility for exactly situations like this. But kudos to the IT team and the vendors that we're working with for getting this accomplished to help all those people that are finding themselves unemployed right now for no no cause of their own, given this pandemic. Okay, next thing, we've got another big piece of news in terms of executive orders today, but we did say earlier in the week that we would be updating our business closures information, and based on the information we have now, based on the modeling we have now, all the closure orders that we had for bars, restaurants, theaters, and athletic facilities, state of North Dakota facilities and personal care businesses. Those were 3 separate orders. They've all been updated to extend the closing dates from April 6th to April 20th. So that's a 2-week extension. And we'll revisit and announce whether that will be extended again or not on or before April 15th, because we want to make sure that we'll give people who've been asking about lead times. Hey, if you're ever going to come off these orders, if you're a restaurant, we need to order food to get back in business. We want to give people lead time to talk to their vendors and their team members to do that. So by on or before April 15th, we'll be giving an update on that. And again, this order applies to all the businesses, and it does apply to all state facilities, that they'll remain under the same executive orders we issued earlier, but the end date moving out to April 20th. Next topic. We know that some of the people that are, the real heroes in our state, we've talked about before, is the first responders, and whether that's, a sheriff's deputy, whether it's a full-time employed person that's in the police department in one of our larger metro areas, or whether it's volunteer ambulance services in our rural areas. We want to make sure that they're all safely protected, and we want to make sure that if need be, if they're entering into a location that has a likelihood of a COVID positive resident, that they would have a chance to know that, so they could put on the personal protective equipment, the gloves, masks, gowns if necessary, before they're, in particular, like if they're responding to a ambulance call or some other call. We've been working through, there have been a number of questions at these meetings about the ability to release public health information. We have navigated that, where we found a way where we believe we can continue to protect people's health information. All sheriffs and police departments through the North Dakota Association of Counties, working with the North Dakota Department of Health, if they're signing waivers as part of this agreement, then the Public Safety Answering Points, acronym PSAP, think of that as 911 operators, 911 locations, that if we get waivers signed from those individuals, they return their non-disclosure agreement, they agree that they're going to protect this location information. We would not be releasing any names, but we would be releasing addresses. So again, we've had a lot of discussion at these meetings about the addresses, and are they valid, the addresses that we have, or the addresses that people put on their test results. So we now have 147 positive test cases. If there's a 911 call, anybody in the state will be able to check and see as they respond in their county, are we responding to a location that has an individual who tested positive for COVID. So they would know that before going to that location. We understand that there could be an error in this, because you could be responding, in a rare case, you could be responding to a location that had an address that says there's COVID, and COVID's not there because the person is a college student, for example, living in another county or even another state, but they included that as their home address. But again, this is a precautionary thing, and recognizes the importance of our 911 responders, and we will, Department of Health, they'll provide it to state radio. State radio will disseminate the address location to the applicable PSAPs that they serve. So if a public safety answering point serves a particular geography, they'll get the addresses for within their geography. They'll enter that information so that they can notify emergency responders. So if someone's asked to go to a certain address, it'll pop up in the system that that was a place that was previously reported. And then we'll also be following up on the backside of this, when someone has recovered, then we will remove that address from the information. Again, no personal health information will be disclosed, but this is important for us to make sure, again, we're protecting those first responders. The one other topic related to this, in some of the calls that we've had with mayors and others, there have been people saying, hey, we don't have enough personal protective equipment for our police, our fire, our first responders. We've talked to the state, and we need equipment. The key point, we found that there's been some maybe misconnections in terms of sort of purchasing and ordering. Our emergency service folks here at the state had a conference call with all the county emergency managers. We made sure that everybody understood the purchasing process for PPE and to streamline us sending out stuff from our state medical cache. And we encourage anybody out in the state of North Dakota to contact their county emergency managers. They'll know how to order from the state, and we can get that equipment out to all of your people in law enforcement and first responders. So those are the announcements for the first part of our program. As we've said before, we've got a strong partnership with Insurance Commissioner Jon Godfread, who's doing a lot of great work collaborating with us and with his own team and with the insurance industry to make sure that the insurance industry keeps rolling through this whole pandemic. He's got a number of orders that they've put out. We want to give him an opportunity to provide an update. So here's Commissioner Jon Godfread.
Thanks, Governor. Let's see. Yeah, I just want to take a minute to update on some of the things we've got going on in the insurance industry. We've issued a number of bulletins and some guidance out there that's available on our website at insurance.nd.gov. I'm going to start with health insurance. That's usually the primary question we've been getting, starting with the employer side of it as well. We've been getting a lot of questions from small business employers, other employers about, in this time of furlough or layoffs, how do we handle health benefits? Our main kind of point to you is if you're an employer and you're offering benefits to your staff, please continue to do so at the best of your ability and utilize that stimulus package that's coming out of the CARES Act. We've worked with the insurance companies operating in North Dakota to ensure that they have the ability and are willing to offer as much flexibility as possible to their employers to ensure that they can keep health insurance benefits flowing to their employees during this time. This was one of the main purposes of the CARES Act, is to get loans and get grants out to the employers in order to keep their employees on the payroll. If you're concerned about a reduction of hours or a furlough situation, my ask is before you terminate anyone's benefits that you talk with your insurance company to see what options are available. Some of these options may include extension of premium deadlines, grace periods, and even on the other side of the coin, if you're now hiring people or bringing them back, is waiving that probationary period so the new staff can get access to those health benefits immediately. These issues need to be addressed on a case-by-case basis with your insurance carrier, and our carriers are ready and able to handle your calls and have assured me that they're willing to provide the greatest level of flexibility they possibly can. That same level of flexibility is being extended to all lines of insurance and to all our consumers. So if you find yourself unable to make a premium payment, please reach out to your insurance company and discuss the different options that are available to you. All insurance companies have been asked to provide flexibility to individuals who find themselves in this difficult situation. However, if you do find yourself unemployed or recently lost your health insurance, you'd qualify for a special enrollment period through the ACA. You can shop that through the healthcare.gov or by reaching out to a local agent. If those plans don't work for you, we also have short-term limited duration plans. They're more of a bare bones policy, but under some of our previous orders, they will cover COVID-19 testing, and they'll provide some level of coverage in the case that you find yourself hospitalized due to the virus. These policies are meant to be for a short period of time, and they essentially operate only as a catastrophic plan. They do not provide the same level of coverage as a traditional major medical policy, but in these situations, they can provide some coverage. We've also expanded telehealth services to encourage social distancing in an attempt to keep our hospitals clear. Services that can now be used expanded telehealth include office visits with your doctor, PT, OT, speech therapy, behavioral health and substance abuse treatments, just to name a few. Many of these visits can be done via FaceTime or through other means of video chat or even a phone call. And I encourage you to reach out to your doctor or service provider to discuss those options that are available to you. We've also asked our entire industry to engage in social distancing. So many of your agencies and agents are going to be closed to public contact, but they'll still be working to process claims and service consumers. Finally, the last point that I want to make is auto insurance. It may seem like a small issue right now, but if you find yourself in a new delivery role, as your duties have maybe changed, it's important to reach out to your auto insurance company to see if you have coverage. Traditionally, those personal policies do not cover commercial activities such as delivering goods or services. So it's important to reach out to your insurance company to talk about that. We've asked them to include that coverage into personal lines for the time being, just to try to cover as many of those folks who may find themselves in the new delivery role given the situation. But again, I know that seems like a small issue, but it can potentially save some pretty significant headaches down the road. So really the long story short is, if you're having financial troubles, if you're in a situation that's changed, prior to making any real drastic decisions or prior to missing any payments or canceling insurance, please reach out to your insurance companies, talk to them, there are options available. We can't issue a broad-based order to do that. That's a very difficult thing to do. But again, the companies have assured us that they're willing to work with consumers on a case-by-case basis to keep them insured and keep their insurance flowing. As always, you can certainly reach out to our office if you have any other questions or find yourself in other difficulty. A lot of this information is available on our website, like I said. Also encourage you to look at ndresponse.gov. It's another great resource for businesses and individuals as they're kind of navigating this time. And with that, turn it back to you, Governor. I'll be here for the Q&A.
Thank you, Commissioner Godfread. And for those that might be watching from out of state, you just heard a great report from the Guinness World of Records, world's tallest male politician. Great guy to have on your team, whether you're playing basketball or whether you're trying to solve the issues of a pandemic. We're great to be on the team with him. Before we get into Q&A, two quick announcements. Today, as you know, was April 1st, was considered Census Day. We want to clear up any confusion about that. Today was the day to try to drive awareness. Today was the day that it's where you were. If you're living in North Dakota now, you should be counted in North Dakota now, in that city, in that county. So that's why it's called the day. So even if you filled out the form last week, or if you fill it out, and I think you've got till August to fill this out, but let's not wait that long. But if you fill it out, say a month from now, you should fill it out and answer the question of where was I living as a resident on April 1st. So that's why today is Census Day. Official day that we count the population in each community, and that's not just once a year, this is once a decade. As of yesterday, I want to say thank you to the high performers out there that got this done. 37%, we believe, of the residents of North Dakota have already responded to the census. And Harwood, North Dakota, home to, I think we have about 1/8 of the governor's staff is from Harwood, including Mark Staples and Jody Hansen. So that would, if you're good at math, then you know how many people we have on our staff. Be 16 if you didn't work that through. But anyway, we have Harwood, North Dakota, 65% of the residents in Harwood have responded to making them the city with the highest response. So shout out to Harwood, North Dakota. Good job on getting the word out there. Sure had nothing to do with those great team members in our office from Harwood, but great work. For cities in North Dakota over 5,000, drum roll. The city with the highest response so far, West Fargo. 50% of the residents responded in West Fargo, and that would be one of our fastest growing communities over the last decade, and so important for those fast growing cities in particular to get that step up in population for all the per capita payments that come out. Long-term impacts that affect our communities, whether Medicare, Medicaid, community health programs, low-income lunch programs, foster care, many more. And so again, you count, we count, everyone needs to be counted. And invitations, have been delivered to about 90% of the households in the state that receive their mail in a no, excuse me, yeah, 90% have been delivered. The 10% that received their mail in a P.O. box has not. Typically, if you have a P.O. box, they want to deliver it to you to your location, so those get delivered by hand. We've said this before, if you fill it out online, then no one will call at your location. That is still true. And the Census Bureau was intending to deliver these by April 12th. They've been delayed in terms of doing that, so there's not, for the reduced spread, people aren't going to be hand delivering to that 10%, but 90% of the state of North Dakota should have either would have received it in the mail, or you can go to the website we had up, my2020census.gov. It takes about 5 minutes to respond online, and you can help our state. Great thing to do when you're staying at home, working from home, and in keeping physical distance is to fill out your census form. Let's see if we can have the highest completion rate of any state in the nation, because if we do, it's like the state wins the lottery for the next 10 years. So go Team ND, go North Dakota on filling that out. The last one is really a notice more for the press, but our Department of Health, we've been reporting our case results twice a day at 10 in the morning and 4 p.m. One of the ways we can get better data and free up a little capacity in our limited lab staff is to go to once a day reporting. And so those reports are going to come out each day at 11 o'clock. This will allow us to do a more adequate time to investigate individuals, in terms of location and other things that we often have questions about. And then it'll also make sure that the website is updated regularly at one time every day. So what that means is tomorrow, April 2nd at 11 a.m., we're going to have a report, but the report tomorrow is probably going to have lower numbers. We'll have to adjust a little bit on our graphing and how we display that, because it's only going to include from 3 p.m. till tomorrow morning at 11. But then going forward, Friday, April 3rd, Saturday, April 4th, and so on, we'll post results from the prior day, the next day at 11 a.m., and that'll give us a chance to do that. So we'll be reporting the next morning the positive cases that came in by midnight. Okay, with that, we'll move to Q&A for either myself or Commissioner Jon Godfread. Lieutenant Governor Sanford is also here. Chris Jones from Human Services here. Bryan Klipfel, who and his team are handling the crush of the 26,000 plus so far, 28,000 plus so far. Unemployment claims and the WSI claims. He's here, and so we'll stand for questions.
Question about those 28,000 claims. I'm wondering if anybody has an indication of which sectors those claims are now coming from, if there's been a shift from the oil industry over to some other industries.
I've been told on good source that the mics are working well enough that we don't have to repeat, but in case Bryan didn't hear in the back of the room, come on up, Bryan. The question was, do we know which industries all these claims might be coming from?
Thank you, Governor. I think the claims are coming in from a wide variety of different types of industries. We probably started out a little bit more with the oil industry because of the slowdown in the oil prices and so forth. But we've been seeing a lot with a lot more claims with the hospitality or accommodations industry. We're getting a lot of those. And that's a larger group than the oil industry would be in, so there's just more people coming in from that arena. But it seems like it's like all over. There's just all different types of industries that are being affected.
Do you have an estimate on what percentage is in the energy sector versus the accommodations or hospitality sector?
I don't have that off the top of my head. I can get that for you. We're keeping track of that data, so I'll make sure that for one of the conferences, the governor has that data. Yeah.
Thanks, Bryan. Lane?
We had a first responder in Western North Dakota contact us, and he was curious what the Department of Health or your office is going to do for first responders' mental health. He thinks that the press conference, or not the press conferences, the press releases aren't doing enough for them.
I guess if people heard the question, what are we doing about mental health for first responders? First of all, I'd say this is an issue for the whole state. Everybody's going through a period of stress. We know that today is the first day of April, and that is also the month, unfortunately, in North Dakota that has the highest suicide rate, which is tied to depression, anxiety, et cetera. So we've been trying to message this and focus this from the beginning. It's part of the Stay Connected, Stay Healthy is not just physical health, but mental health. First responders, particularly in rural areas, they got a tough job to start out with. Because a lot of these folks in the rural areas are, volunteers. They might have some kind of, pager cell phone system at home. They could be getting a call in the middle of the night. They got to jump up, leave their families. Middle of the day, they might be leaving their job. They're volunteers to go out and go on calls, and those calls can be, stressful and traumatic. I mean, you're going out to a fatal traffic accident. It might be, if you're in a rural area, you might even know the person that you're going to help, or if it's a health emergency, same thing. So this is a stressful job for people that are doing it. The people that do it are real heroes, and we've got to make sure that we're helping take care of them. But the issue we've got, of course, is a shortage of emergency responders around the state. And so what they're seeing, what we've seen in other states, is they're not getting time off, because one of the ways you manage your mental health is with the appropriate kind of breaks and rest and all that. So we don't have a good answer on this one right now, because we are short-staffed with people. And I would say again, for those of you that are in that area, then and we're in this period of physical distancing, when we're talking about stay connected, that community really needs to stay connected with each other and support each other and help each other. As part of what we announced yesterday on the workforce coordination center that we announced, I mean, part of that is identifying, are there people who've got EMTs licensure that could be reactivated, or maybe they're active, they're not working? Can we get other people to help volunteer? Could we get people that are, are qualified to drive, but may not be qualified to deliver care, as a way to, help staff up? And so again, I would encourage, if somebody is out there and wants to help, get involved with this group of heroes, contact the Workforce Coordination Center, or, if you're in an area and you know somebody who's running your local ambulance service, call and check in with them. Staffing. If you look at places that have hit the peak, one of the constraints, again, is maybe not be beds. You can make more ventilators, you can set up more beds, but in the end, it's qualified staff that are willing to step in and be on the front lines is where the shortages are. So we're grateful for anybody that is. And Lane, you had the tail part of that. I'm not sure I quite understood the answer to that about the.
He said that there's press releases being sent out to first responders about what to do about your mental health, and he thinks that they're not doing enough.
Okay, those specific ones. Okay, well, we'll just take that as feedback and pass that on. I know our great behavioral health team in the state of North Dakota is working, and we'll try to zero in even more specifically on healthcare workers and first responders. But good input. Thank you. Jacob?
Governor, back to oil. One of the largest energy firms in the Bakken filed for bankruptcy earlier today. First, how concerned should we be that we see a pattern of this in the near future? And is there anything your office is considering to convince companies or help companies avoid filing for bankruptcy?
Well, on your question today, with the filing of one of our really good companies in North Dakota, it might be the first significant one. It won't be the last. And bankruptcy, of course, in the different chapters in the legal code offer protection for companies. And so if you're in a business that's facing a collapse in revenue, it's a reasonable choice to make right now. I mean, it might actually be one of the ways that people survive and work their way through this thing. But it is not just about that company and their employees. It's also about all of the partners that they worked with, because in the wake of that announcement this morning, then people reached out to our office and said, oh, we were a partner with them. We'd extended, $4 million of credit to this organization. So you get the cascading effect where it's not just the company, it's not just the people that work for them, it's all of their business partners. And the energy industry is a very interconnected place. And when the dominoes start falling, they generally don't fall alone. They hit other people on the way down. And this is, again, why we've got a second crisis going on, which is in North Dakota. We probably have 3 or 4 or 5 going on, but a big one for the state of North Dakota is the drop in oil prices. Because related to that, when oil prices are low, we're also going to probably have the double whammy of seeing production drop, because if it's not profitable for oil companies to keep producing at these prices, and they are sending employees home, they'll shut in their wells, save that production for a time when that comes back. But when they shut in their wells, which is a smart economic decision for them to try to preserve their company, preserve their opportunity to come back, but that also then drops the revenue for North Dakota. So in our forecast, it's always price times volume, and we've been fortunate that even during periods of lower prices, we've had very high volume, but the 1.5 million barrels a day is not in our future with these prices. That number is going to drop and could drop precipitously. So going to create real pressure on state budgets because of that, and we will likely see other companies filing bankruptcy. Asking about what we might do for them as part of the second part of that question. I think, again, the state of North Dakota, in terms of what the state would do in terms of what I'll call economic stimulus or economic support packages, the guidance that we're giving all of our team that's working on that is we've got to keep sifting through all of the federal stuff, which, as we've talked about here this week, is all incredible. And then there's talk already about what they're calling in shorthand STIM 4. If there have been 3 packages passed already, including the CARES Act, would be considered STIM 3. When Congress reconvenes later this month, I'm sure one of the first things they're going to take up is STIM 4. There was really nothing in this first 1, 2, and 3 that related to the energy industries per se, and given the importance of that to national security and global geopolitics, the manufacturing sector, all of that, I would think that they're going to have to take a look at what are they going to do federally to support the energy sector. Dave Thompson from Prairie Public.
Just to follow up on that, because you are concerned about budgets, you had to postpone the first forecasting, shall we say, meetings on that. How tough is it to have to look at a budget right now? And when do you think you might get to the point of doing a forecast?
Well, how tough it is to look at a budget right now? It's very tough because we've got we had, as I'm sure every state probably went out and said, hey, the forecast we have out is conservative. And we thought it was conservative till about 3 weeks ago because we were running 8% ahead on 6 to 8% ahead on revenue. We were a couple $100 million ahead 8 months into a 24-month biennium. So you feel pretty good about it. I'm certain that now we're running that we've dropped below our forecast, and we may stay below that for a long time. The question that'll be really hard when you're forecasting for a 2-year period is what's going to happen, starting this summer when the economy starts coming back. I mean, trying to put a crystal ball on, when will oil prices come back? When will production come back? When will travel come back? When will hospitality come back? When will all this come back? And then you also then can't, it's impossible to forecast how much of that federal stimulus, when that comes into the economy, what's it going to do to stimulate economic activity? And from a state's perspective, how much of it's taxable or not? So I would have to say this will be the most challenging forecasting environment ever for any state since probably, this has got to be harder than the Great Depression. There's just more variables going on, during this than there were during that period of time, and so it'd be very challenging. But is North Dakota up to it? Yeah, absolutely. I think we got the people and the ideas and the processes and the nimbleness. If anybody's going to navigate their way through this, it's going to be North Dakota. And it again varies state by state. Florida is slightly now larger in population than New York. New York's budget is twice the size of Florida's. I mean, so if you're a state that's got a large budget, right now, you're going to have extra challenges. Got one question coming in from online.
Chris Larson with AM 1100 The Flag in Fargo. There are many families which have shared custody agreements in which the children may spend the summer with one parent. How should parents handle these arrangements, particularly when one parent may live out of state?
Getting asked a shared custody parenting question, and this is I want to say this is probably going to have to be handled by that individual family, because I don't think the state of North Dakota is going to be getting involved in trying to make any decisions for what's the best interest for children or where they should stay. And again, I keep coming back to the health risks of this pandemic for young people is very low, and that's a good thing. And so whether they're with their mom or their dad and what location they're in, their health risks probably are similar in each location. So I don't know that that would be a factor. I'm sure there'd be a bunch of other factors, but that's one we'll let those families sort that one out. I'm going to go back here. Ryan, thanks for being here.
Disaster declaration, is there any way to quantify what that means in terms of actual dollars?
On the presidential disaster deck, is there any way to quantify the dollars? The answer is not yet. Because generally the way those work, it's as we said here before, it's we spend the money, we track the receipts, we submit the stuff to the feds, just like we would after a flood, to say these are the qualifying receipts, and again, that could be substantial amounts of dollars in this situation. So it's great to have received it, and like we say, telling everybody, right, this is a time, if you're a township, a county, a city, or a state agency, track your receipts related to COVID, because a lot of that federal reimbursement will be going back to that, which is, do they qualify or not related to that? Okay, we'll do Jeremy and then another one online.
So I'm wondering if you think this April 20th date is realistic or optimistic for bars, restaurants, and other businesses to potentially reopen?
April 20th, realistic or optimistic? I'd say it's pragmatic, and the reason why it's pragmatic is because we're getting so much more information every single day, and we will have so much more information before April 20th. I mean, we said we'll give an update by April 15th, but even in 2 weeks, I mean, sometimes we've got more information in the afternoon than we had in the morning. And part of what we're going to be able to see is even by April 15th, 2 weeks from now, we will know whether if some of the states in the United States hit their peaks or not. We'll know whether or not they're on the way down. We'll know whether or not the forecasts are accurate. All the models that are out there, which again are, there's a wide range of models and a wide debate about the models on their accuracy. But the one thing I do know, the best models are being updated daily. They're being updated daily with not only information state by state, county by county, but they're also being updated by information, particularly from the European countries, which are more relevant than updating models with China or Korea, because the European countries look more like the U.S. in terms of the actual, a democracy controls on the limits of freedom and movement. The models from Europe are probably more relevant, but we'll have a lot more information. And so I think it's pragmatic for us to say we'll extend them for 2 more weeks, because we want to be closed as long as we have to save lives, and then not a day longer. It would be, this is again, tough environment to try to pick a date 30 days out with any certainty. So we think it's pragmatic here that we're looking at this thing very closely and doing it in 2-week increments. Another one online.
Robin Travers with 660 KEYZ in Williston. Is the state considering using the legacy fund to help alleviate some of the massive numbers of unemployment?
Thanks for the question coming in from Williston on the legacy fund, using it for unemployment. I'd say right now the answer is no. Ultimately, how the legacy fund gets decided and how it's spent is up to the legislature. But as we just talked about, the legacy funds, that the earnings that come off the legacy fund are deposited in the general fund. If we're in a situation where we've had a collapse in state revenues, you might be using legacy fund earnings to help cover the cost of operating government. In terms of the protected gaps in the unemployment insurance, Lieutenant Governor Sanford and I have both had an opportunity to talk to our congressional delegation about that. Right now in the STEM 1 and 2 in the CARES Act, there's not specific funding to replenish unemployment insurance accounts at the state level, and there's a lot of money for funding unemployment, but there's a state portion and a federal portion. The federal dollars come on top of that. We talked about that. I mean, typical payment in North Dakota might be $600 from North Dakota, another $600 on top of that, or $1,200 a week during this period of time with this extra CARES Act unemployment. But the North Dakota portion, making sure that we've got enough funding to keep going that, we think that many states will be asking the federal government to look in the next stimulus package how to make sure that they can shore up the state unemployment insurance accounts. Ours is in better shape than most other states, so we're in better shape than others right now. So again, there'll be plenty of other states leading that fight to try to get more federal funding to make sure that we can support the unemployment, because this is a different period of time. When people hear unemployment, they might in their head be going, yeah, well, why don't these people get a job? No, this is different, because this is the first time where government has actually asked businesses to close, and then people are closing their businesses and laying off employees because we're asking them because of a health emergency. So again, even as someone who believes in free markets and believes in a conservative approach from a fiscal standpoint, this is different in terms of the responsibility that government has, because we've asked businesses to close, and I think we got to step up and help out them and those businesses and their employees. And that's why I think it's appropriate the federal government they're looking very generously at unemployment, and I hope they'll continue to look at shoring up the unemployment insurance accounts. Lane, and then Jeremy, and then Jacob.
With more and more cases being due to close contact or community spread, do you feel like there's enough emphasis on social distancing?
Quick answer to that is no. Keep getting reports on the social distancing, the physical distance from mayors, from yesterday's calls with the healthcare leaders, the anecdotal, people that are working in essential jobs or people that are working in healthcare driving to and from their homes, they just reporting lots of activity and people getting together that would not follow the guidance. So again, we get asked every day about, dialing up more mandatory controls, and I would keep asking North Dakotans, if you like your liberty and you like your freedom, you like living in North Dakota, this is a chance to really prove that you like it by following your individual responsibility and making sure that you're following the guidelines that we've put out there. And I think when you do that, again, you're protecting your family, you're protecting your friends, and you're saving lives of people you may not even know because of community spread. You could be spreading it to someone who's elderly and vulnerable, and this is a very deadly disease, 15 times more deadly than the flu. And I don't think anybody would want to be, I don't think anybody wants to go back and, I'll be really dramatic. I think we've got over a dozen states that have got multiple death outbreaks in nursing homes. We're not one of those states. I think Minnesota's reported that they've got COVID in, 22 different long-term care facilities. Nobody wants to be the person that didn't take this seriously and said the rules don't apply to me, and they're the ones that carried this infection into a nursing home and would lead to death. So I just think that's a dramatic case, but that's happened. It's happened, and we don't want it to happen here. So again, individual responsibility, but if we have to, we will for public safety. But right now, again, we just keep encouraging people to follow the rules and the guidance we've given.
Governor, there have been layoffs and furloughs in lots of different sectors. Could we expect to see layoffs or furloughs in the public sector at the state level?
layoffs or furloughs in the public sector, right now, that's not something we've discussed or talked about. I think that when we take a look at the potential revenue declines, I think it's very likely that, before the year's open, when we went through this, the last crash, state of North Dakota was, we were cutting budgets, we were offering early retirement, we were going through a budgeting cycle on, how to, tighten our belts. And I don't think the public sector is going to avoid, every business in North Dakota is probably going to have to tighten their belt coming out the backside of this thing. And I don't think the public sector is going to avoid that, whether that's a city or a state. So I think it would be Pollyannish to think that we're not going to also have to take steps, and it's appropriate that we would, because everybody else is having to too. But right now, no, we need the people that are working for the state of North Dakota are doing essential work, and those that are working from home, we thank them for continuing to get all their work done and more. Some of those state employees are working harder than they ever have because of the spikes in loads that are coming into certain agencies, and so again, we're grateful for all the work that they're doing. But we've suspended our strategic planning process that we were going through this spring because of those were all, lots of people in relatively small rooms, and so we've suspended that. We want to kick that process up again, and I'm sure when we do, it's going to have a little bit more of it's going to include innovation and reinvention, but it's going to be with a strong focus on ideas around innovation and reinvention that would also allow us to be more efficient in how we deliver services. Jacob, KFYR.
Governor, with the business closures now extended, are you aware of any citations being given to companies who weren't following, or the effectiveness of companies complying?
Not aware. Haven't been notified, and that, of course, would have been happening at the local city enforcement level, but have not been made of any notifications. I think the general sense is that lots of compliance on business closures and less compliance on the social distancing, the social part of, we're doing a lot of the social and not enough of the distancing, maybe a way to say it. Question from online?
Matt Henson with WDAY in Fargo. Are there any options or programs available for people who may have been on unemployment that ended shortly before this crisis?
That's a question maybe Bryan can take. You want to charge up here and do that? They're saying people heard that, but unemployment for people that may have expired before the crisis.
So this is a great opportunity to get the word out on these CARES Act, the unemployment insurance stimulus package. So there are really three major parts. Waiving the 1 week was one of them that we really did, that we finally got going. But the other ones we signed the agreement on last weekend already. So one of the parts of it is for people who have normally wouldn't pay in for unemployment insurance, like independent contractors, self-employed, people who don't have enough wages to get unemployment insurance. They fall under one of the programs on there which will cover unemployment insurance for them, and that's part of the stimulus package. The second thing is we have, and the governor's alluded to this, is the $600 that's added onto your unemployment benefits. So that's another stimulus that is coming down. And then the third one is if you are on unemployment and you're off unemployment, for example, like maybe construction workers or some contractors, there's an extension of 13 weeks of benefits that they can get on top of their if they've run out of the unemployment benefits already. So that's really an important thing to help the citizens out in the state. So the part I was going to have the media help us on a little bit is that this is a federal program. We just received the information last weekend. We haven't received any Department of Labor guidelines on how we're supposed to handle it yet, but we will be getting that shortly. And then at that point, we will look at getting the benefits out. So people who qualify in those categories that I just referred to, especially for those that, haven't paid in for unemployment insurance. We are going to have a separate application on our website. We're working on that process right now. So check jobsnd.com to see if you can get that information. And you can apply then. Because if you apply for regular unemployment online, you're going to get denied because it has to be under this special program that we have. So make sure the word gets out on that that's how you're going to get the benefits. And I think there's some real good programs to help our citizens. So.
Thanks, Brian. I just want to add to that because there's a lot of talk about unemployment and how do we get benefits, but I just want to give like the briefest brief. Typically, the way unemployment has worked in the past is if you were an employer, you paid dollars into an employment insurance fund for everybody that worked for you. And that fund built up. And if you never laid anybody off and never had anybody that was unemployed, then you probably weren't getting the benefits back because you were paying into a fund and somebody else who was having layoffs, that insurance fund was paying for their unemployment benefits. And that's why we talk about questions about, how beefed up is the unemployment insurance fund if it's going to have this wave of people coming at it. The federal dollars come on top of that, to sort of beef up the benefits to individuals because the feds are printing that money. But the questions that we were getting all last week, which is appropriate, like, well, what about the person that rents a booth in a hair salon, has a booth license and cuts hair? Well, they're not paying any unemployment insurance, and so typically they would have never been eligible for any insurance because they weren't paying in, they didn't work for anybody. If you were an Uber driver, if you had a little business at home where you were doing, setting up websites at home, I mean, the whole gig economy, as it's called, all those jobs, people are like, well, this doesn't apply to me. Check out the new programs. There's an opportunity, this new thing that Brian's talking about in terms of having a new application or website. You could have never paid into unemployment insurance in your life. You can be a sole proprietor and you can qualify for this. So again, when we talk about things that have never happened before, this is clearly one of them because people that have never paid insurance in are going to get a check out. It's like you didn't have an insurance program and you weren't paying a premium and you didn't work for anybody who was paying the premium for you, but all of a sudden you're going to get a premium check. So it is quite amazing what's in there. We were just on a call this morning with one of the leaders from SBA, and as this information is coming out, we had close to 500 community bankers on the call today. I would refer people to Michelle Comer and our Commerce Department for more details on this as well. But there's, and the SBA directly, the North Dakota leader for SBA had a lot of that information, but there's some amazing stuff that, as Brian said, we do need to get the word out because people that maybe never thought they had qualified would qualify today.
One more as a follow-up. Do you anticipate there will be any across-the-board budget cuts in state government right now in anticipation of some of the revenue shortfalls?
Do I anticipate any across-the-board cuts? I think I've been on the record many times. I've never liked across-the-board cuts because that implies that every need is equal and every department is the same. But the way the system is set up to access the budget stabilization fund, the way to do that is we have to first, have revenue drop below forecast by a certain percentage. And then when it falls below that, then the governor has the ability to do an allotment, which is, in fact, an across-the-board cut. And right now, that's the only way to access the budget stabilization fund if we needed to access that, say, between now and when the legislature's back in session, when they convene next December. So it is always a possibility when you have a time of down revenue that you have to enact the allotment process. But it's the tool that we have right now, but it's not my favorite tool because certainly it kind of, I don't want to say it's undoubtedly going to create imperfections in terms of strategically cutting, because you have to cut the important things just like you have to cut the unimportant things at the same time because everybody gets the same percent. One more online.
Renee Jean with the Williston Herald. How is the state accomplishing contact tracing for non-resident individuals who test positive in North Dakota?
Another question on contact tracing for non-resident individuals. Is there anybody in the room that wants to take this one, or? Okay, I'll just jump in and say the process, and again, this would be in a hypothetical case that someone was here, took a test here with one of our providers here, but then has since left the state, and we inform the provider informs that individual that they've tested positive, and to my understanding, the contact tracing in that situation would occur the same way, which is the health department would call the individual who is in North Dakota and go, what days were you here? When did you start feeling poorly? When did you start experiencing symptoms? Who were you in contact with? Who were you within close proximity to? Who were you under 6 feet for more than 15 minutes? Tell us about where you went, where you might have gone, and who you might have interacted with. And then we call. Once we get the list of those names, then you start calling the next set of people to do that. So that's contact tracing is a labor intensive. There's a training process. We're training up. We're getting way more people involved. We've expanded our capacity in that. We want to get it broader, but it is really kind of detective work to try to track people down. I would say, one of the best practices that some of the health organizations in North Dakota have instituted, they've asked their employees in those health organizations to keep a daily journal of everybody that you're in contact with. So if you do find yourself testing positive, you go back to your journal and go, yep, these were all the coworkers I was with, these are the people that I worked with, and so that people can be more ready to answer those questions. And I know some citizens might even be doing that, particularly if they're trying to think really thoughtfully about protecting their loved ones, or if they're in a situation where they have contact with elderly or people with underlying conditions, and you find yourself not feeling well, then you may want to raise your hand and make sure that you're aware of who all you've been in contact. And so that's a thoughtful thing to do, is to increase your awareness about who you're interacting with. Okay, that brings us to the end of the hour. Again, I want to thank everybody that's listening in to these conferences. Want to thank the media for all the great work you're doing and helping to get information out there. We've talked about important information sources. I think it's important, again, on the trusted sources that we've talked about in the past: ndresponse.com, ndresponse.gov, and health.nd.gov, those two websites. Make sure you're doing that. In particular, today, it is April Fool's Day, and I've seen some pretty interesting things online, even more than others. I've even had some interesting things on my own calendar that showed up that I was like, wow, didn't know I was doing that interview tonight, but turned out that was an April Fool's joke. So anyway, it is we have to go to your trusted sources and make sure that make sure that on today in particular, that everything that you read online may or may not be true. And so again, as we talk about North Dakota Smart, it's about staying home, it's about staying healthy, it's about staying connected. Thank you all, and have a great day.